Let's talk about the lymphatic drainage of the head and neck region. So the lymph nodes of the head and neck region are generally divided into a total of three categories. We have the superficial group, we have the deep group, and then we have the deepest group. So first of all, you need to be able to enumerate the lymph nodes, and then you need to have an idea of the pattern of drainage. So let's start with the superficial lymphatic nodes of the head and neck region, and I'll show you the images and I'll try to make it an interactive session. So the first lymph node you need to be able to memorize from the superficial lymph node category is a lymph node group known as the buccal lymph nodes over here. So the buccal lymph nodes are located over here, right, over the buccinator. And for those of you who have already gone through the muscles of facial expression, you would know that the buccinator is the muscle of the cheek, and this is a superficial lymph node, superficial group of lymph node. And so the buccal lymph nodes, they are superficial to the buccinator muscle, and that is all you need to know in order to be able to understand the location and the category. Superficial lymph node location lies on the buccinator, right? So this is the first. The second name is the pre-auricular lymph node, and the pre-auricular lymph nodes are represented over here, right? These are the pre-auricular lymph nodes. Pre generally means anterior in anatomy. Then we have the third group known as the post-auricular. The auricle refers to the pinna over here. This is the pinna, and these are the post-auricular lymph nodes. You would be wondering, but over here it is written as the mastoid lymph nodes. Actually, the post-auricular lymph nodes are also known as the mastoid lymph nodes simply because the post-auricular lymph nodes, they're found, or they lie on the mastoid process, and the mastoid process is just behind the auricle. Don't believe me? Feel it. Behind your auricle, behind your pinna, you can feel a bony prominence. This is the mastoid process of the temporal bone. So we have considered 3 out of 6 superficial lymph nodes of the head and neck region. Over here we have and another way of understanding the location is that the post-auricular / the mastoid lymph nodes, they are superficial to the sternocleidomastoid muscle. This over here is the outline of the sternocleidomastoid, and as you can see, the sternocleidomastoid is covered by the deep fascia, and superficial to the sternocleidomastoid and the deep fascia we have the mastoid lymph nodes. So onwards to the occipital lymph nodes. Over here, these are the occipital lymph nodes. The occipital nodes, they lie at the apex of the posterior triangle of the neck. This is the posterior triangle of the neck, with the posterior border of the sternocleidomastoid is the anterior boundary, and the anterior border of the trapezius as the posterior boundary of the triangle, and then over here we have the clavicle as the inferior border. So at the apex of the posterior triangle of the neck, we have the occipital nodes, which are also superficial lymph nodes as you would expect, and they're lying at the apex of it, and they're superficial to the attachment of the trapezius. This is where we have the attachment of the trapezius on the superficial nuchal line. This is about the area of the superficial nuchal line, and these lymph nodes are superficial to this attachment. Then we can see the anterior superficial cervical lymph nodes and the lateral superficial cervical lymph nodes. The anterior superficial cervical lymph nodes are lying along a vein known as the, what is the name of this vein? This is the anterior jugular vein. And the lateral superficial cervical nodes, which are located more laterally, they lie along the external jugular vein. Please do not confuse with the internal, this has already been labeled anyways. So we're done with the location of the superficial group. Now let's talk about the deep group. Let's go with the names. Pre-Auricular lymph node, mastoid lymph node, occipital lymph node, anterior superficial cervical lymph node, and the lateral superficial cervical lymph node. Let me see if I can find an interesting image clarifying this point. So when we do the deep lymph nodes, this will be more interesting. So this is the parotid, aka the pre-auricular, right? Back to this point over here. Now let's enumerate the deep nodes first. First deep node you need to be able to remember is the submental hyphen submandibular lymph nodes, because they're so close to each other. And these are very important, especially the submandibular lymph node, because they have a wide area of distribution, so they're clinically important. Then we have this interesting series of nodes, second, third, and fourth, and these are known as the lateral jugular lymph nodes, because they're located along the internal jugular vein. So these are known as the upper lateral group. Then we have the middle lateral group, and then we have the lower lateral group of lateral jugular lymph nodes. Interesting name. So these are the lateral jugular lymph nodes because they are lateral and they're also related to the internal jugular vein, and you give them upper, middle, and lower as the prefixes depending on the location, the vertical location. So over here we can see the submental lymph nodes, and over here we can see the submandibular lymph nodes, and this over here is a boundary of the muscle. Submental lymph node, submandibular lymph node, upper lateral jugular lymph node, lower lateral jugular lymph node, my apologies, middle lateral jugular lymph node, and lower lateral jugular lymph node. Then you can see in this area we have the lymph nodes in the posterior cervical triangle, right? Now, and these are present around the spinal root of the accessory nerve. The accessory nerve, as you know, has two roots, a cranial and a spinal. Let's see if we have any representation. We do have a representation along the accessory nerve. Over here it is written parallel to the internal jugular vein. So this is referring actually to the lateral jugular lymph nodes, right? And here we have the occipital lymph node, auricular lymph node, buccal lymph node, submandibular lymph node, the facial lymph node, and this is the area that is being drained. The laryngo-tracheo-thyroidal area is being drained over here, and over here we have the jugulo-subclavian venous junction, and that is also where the thoracic, my apologies, I was right, the thoracic duct ends up draining. So we have considered the names of the deep nodes. Let's go over these one more time. Submental lymph node, submandibular lymph node, upper lateral jugular lymph node, middle lateral jugular lymph node, lower lateral jugular lymph node. And we have the lymph nodes in the posterior triangle deepest. Pre-laryngeal and the pre-tracheal nodes, and the para-tracheal nodes and the retropharyngeal. You will not be able to see these over here because they're deeper than even the ones we're considering. So in this image over here, this is a cross section, this is the vertebrae, so this is posterior, right? And these are the lobes of the thyroid gland. So this is the pre-laryngeal and the pre-tracheal lymph nodes, because this is, as you can see, is the thyroid gland, which is a part of the larynx, and the larynx continues as the trachea. So this is the pre-laryngeal lymph node and this is the pre-tracheal lymph node. And these are the para-tracheal lymph nodes because they're on either side of the trachea. So pre-laryngeal, pre-tracheal lymph nodes in yellow, the para-tracheal lymph nodes in blue, and we also have the retropharyngeal lymph nodes. And you can see this is the pharynx, and this is what you see, this is the vertebrae. In fact, this is the atlas vertebrae represented, and we can see the muscles, and we know the prevertebral fascia is around the vertebrae and the vertebral muscles. So just in front of the prevertebral fascia we have the retropharyngeal lymph nodes behind the pharynx. So now we're done with the locations, we'll talk about the details now. So we've talked about the location of the buccal lymph node, that it is lying on the buccinator muscle. And what is it draining? It is draining part of the cheek because it is lying on the muscle of the cheek, and it also happens to drain the lower eyelid. You know, we have two eyelids, an upper and a lower, which close the palpebral fissure, right? So nothing too difficult over here. You need to know where the efferents are coming from and where the efferents are going, and over here you can clearly see where the efferents are going. They're passing to the antero-superior group of the deep cervical nodes. So the deep cervical nodes are generally divided into various groups, and we have the antero-superior group. And so this is draining into the, this is anterior and this is superior and inferior. So the drainage is into the antero-superior group of lymph nodes. We divide the deep group into 5 levels, into the submental, the submandibular, and the upper lateral group, the middle lateral group, the lower lateral group, and the lymph nodes in the posterior triangle. So we have a division into 5 levels, and the buccal lymph nodes are draining into the antero-superior group of the deep cervical lymph nodes. You can see them going towards the, or draining into the submental and the submandibular lymph nodes. Right? And these are the levels of the deep nodes. This is level 1, and this is known as the level 1 or the submental and the submandibular nodes. And what is being drained? The lip, the oral cavity, and the skin of the lower face. Anyways, so what about the pre-auricular lymph nodes? Which area is drained by it? As you would imagine, considering the location, these are located over here. It's draining the parotid gland, which is located in this area. It is draining the temporal region. You can see the efferents coming in from above, and also the middle ear, all the parts of it is being drained by the pre-auricular nodes. So the parotid gland, the temporal region, and the middle ear cavity. What about the mastoid nodes? As we know, they're lying on the mastoid process, not shown over here, but this is the mastoid process, so this is where they're going to be located. So superficial to the sternocleidomastoid and deep to the auriculus posterior muscle basically goes like this. So deep to the mastoid process, my apologies, superficial to the mastoid process and deep to the auricularis posterior. So they drain a strip of skin or a strip of scalp that happens to be both superior and behind the auricle. The auricle, as you know, is the pinna. And also the mastoid process, it ends up draining the medial surface of the pinna. The surface that you're seeing is the lateral surface. This area, the part that you cannot see, is the medial surface. So the upper half of the medial surface of the auricle drains into the mastoid lymph nodes as well as the margins. The margins of the lymph nodes also drain into the mastoid lymph nodes. And the posterior wall of the external acoustic meatus. The external acoustic meatus has anterior and posterior wall. The anterior wall is formed by the tympanic plate. The posterior plate part is not. So this part, formed by the mastoid process, drains into the mastoid lymph nodes. And all of these, from there the efferents pass to the postero-superior group of the deep cervical nodes. This was the anterosuperior. Now the drainage is into the posterior-superior group of deep cervical lymph nodes. Anterosuperior, my apologies, anterosuperior drainage. Over here it wasn't mentioned. Posterior-superior drainage, because these are anterior and superior and these are posterior and superior, and so their drainage into the deep nodes would be similar. These themselves are the superficial lymph nodes. Now the occipital nodes. The occipital nodes, they are draining the occipital region of the scalp. So obviously the scalp and the occipital region, and the efferents, they pass to the supraclavicular members of the postero-inferior group of deep cervical nodes. So these are going to be draining into the postero-inferior group of deep cervical lymph nodes, and among them which particular group? The supraclavicular. And I had this image over here. Let's see if, yeah, these are the supraclavicular lymph nodes of the postero-inferior group of lymph nodes. So efferents from the buccal lymph nodes are going into the anterosuperior group of deep cervical lymph nodes. From the mastoid or the post-auricular are going into the posterior-superior group of deep cervical lymph nodes, and from the occipital are going to the posterior-inferior group of deep cervical lymph nodes, and specifically into the supraclavicular lymph nodes. Area is obvious. The scalp of the occipital region drains over here. Strip of scalp that is above and behind the auricle, as well as the posterior wall of the auricle, the margin of the auricle, the upper part of the medial surface of the auricle, all of these are draining into the post-auricular lymph nodes. Now let's talk about the anterior superior cervical and the lateral superior superficial cervical. My apologies, anterior superficial cervical. Right, so we have the anterior superficial cervical lymph nodes and the lateral superficial cervical lymph nodes. Right. Now the anterior superficial cervical lymph nodes, they lie along the anterior jugular vein. They're lying along the anterior jugular vein, and the lateral superficial cervical lymph nodes are lying along the which jugular vein? External jugular vein. The anterior cervical nodes lie along the anterior jugular vein and are unimportant. The suprasternal lymph node is a member of this group. Which lymph node? The suprasternal. So we now know a particular lymph node that is a member of the anterior superficial cervical lymph nodes, and they drain the skin of the anterior part of the neck below the hide bone. This is the location of the hide bone. So the anterior part of the neck below the hide bone drains into the anterior superficial cervical lymph nodes. What about the lateral? These are lying along the anterior jugular vein, and this lies along the external jugular vein, and they drain the lobule of the auricle, and this part without any cartilage is the lobule, and so the lobule drains over here, right? And also the floor of the external acoustic meatus. This is the floor of the external acoustic meatus. The floor of the external acoustic meatus, and also the lobule of the auricle, and the skin over the lower parotid region. This is the parotid region, this is the lower parotid region, and this over here is the area of the angle of the mandible. All of these areas basically drain into here, right? And the efferents, they pass around both borders of the muscle, right, to reach the upper and the lower deep cervical nodes. So both the upper and the lower deep cervical nodes, upper and lower, not just the upper or the lower, the upper and the lower. And we've already considered where the upper and the lower deep cervical nodes are located: above and below. So let's see if we can find something more interesting from over here. Apparently not. So this is the pre-auricular lymph node, post-auricular lymph node, buccal lymph node. First, buccal lymph node number 1, number 2 pre-auricular, number 3 post-auricular, number 4 occipital lymph node, number 5 anterior superficial cervical lymph node, number 6 is the lateral over here, written as posterior lateral superficial cervical lymph node. So this is the buccal lymph node again, and the lower eyelid and the part of the cheek drains over here, and the efferents, they head towards the anterosuperior deep cervical lymph nodes. So basically the submental and the submandibular lymph nodes. This is the pre-auricular lymph node, drains the parotid area, the temporal region, right, and the middle ear cavity. These are the mastoid or the post-auricular, and they drain a strip of scalp that is above and behind the auricle, as well as the posterior wall of the auricle, the margin of the posterior wall of the external acoustic matrix, the margin of the auricle, and the upper part of the medial surface of it, right? And this one is located superficial to the mastoid process and the sternocleidomastoid and deep to the auricularis posterior. The occipital node is found at the apex of the posterior triangle of the neck, just superficial to the attachment of the trapezius, which forms the posterior border of it, drains the scalp of the occipital. Now the external, the external superficial cervical lymph nodes, they basically grouped them together over here. They're basically going to be draining the floor of the external acoustic matrix, as well as the lobule of the auricle, and the skin of the lower parotid region, and the skin over the angle of the mandible. Now let's talk about the deep group over here. And we have the deep group over here: submental lymph node, submandibular lymph node, upper lateral jugular lymph node, middle lateral jugular lymph node, lower lateral jugular lymph node, and the lymph nodes in the posterior cervical triangle. Now the submental and the submandibular nodes. The submental nodes, they lie deep to the chin. This is the chin, deep to it, and these drain the lymph from the tip of the tongue and the anterior part of the floor of the mouth. So the floor of the mouth is basically formed by the mylohyoid muscle, so the anterior part of it and the tip of the tongue, because this is also located at the tip of the chin, so that does make sense. They basically drain over here. Now the submandibular lymph nodes, on the other hand, they drain the lateral surface of the tongue, as well as the lower gums and the teeth and the central area of the forehead. I'll show you an image. So in this image you can see that the tip of the tongue drains into the submental lymph nodes, and the lateral surfaces or the lateral aspect of it drains into the submandibular, right? So that is what I wanted to show to you, right? And additionally, in addition to the tip of the tongue, the anterior part of the mouth of the oral cavity also drains into the submental, and as for the submandibular, it drains the lower gums and teeth. So the teeth and the gums of the lower jaw, and also the central area of the forehead. Touch your forehead and try to remember that also drains into the submandibular lymph nodes, even though they seem so far removed. The submandibular lymph node, interestingly, is very clinically important because of its wide area of drainage, and the submandibular lymph nodes are very commonly enlarged, and the nodes, they lie beneath the deep cervical fascia. So we have the investing layer of the deep cervical fascia. So this is beneath the deep cervical fascia. On the surface of the submandibular gland, as you can see, not in this image particularly. Let me see, there's probably one in which it is shown clearly. Apparently not. So as you can see, it is found deep to the deep cervical fascia and on the surface of the submandibular salivary gland, and this is the submandibular salivary gland. And which areas are drained is the real question. So the center of the forehead, just the center of it, not the whole part of it. The nose with the sinuses within the bones that form the wall of the nose, the frontal, the maxillary, and the ethmoidal ear sinuses, they all drain into the submandibular lymph nodes. Frontal, maxillary, and the ethmoidal. The upper lip drains into the submandibular lymph node, and the anterior part of the cheek, because we're saying some part of the cheek drains into the buccal, but the anterior part of the cheek and the upper part of the lip, and because the upper lip and the anterior part of the cheek is included, so the underlying gum and teeth also drains into the submandibular lymph nodes, right? Now the outer part of the lower lip, so outer part would be the lateral part. Now the outer part of the lower lip with the lower gums and teeth, with the exception of the incisors, also drain into the submandibular lymph nodes. The anterior 2/3 of the tongue, excluding the tip and the floor of the mouth. So anterior 2/3 of the tongue, excluding the tip and the floor of the mouth, also drains into the submandibular lymph nodes. Right? Again, let me show to you. You can see submandibular lymph nodes, with the exception of the teeth, they are indeed draining the tongue. The anterior 2/3 of the tongue, the posterior is not drained by it, right? Excluding the tip and the floor of the mouth, right? And they also receive efferents from the submental lymph nodes, from submental to submandibular. Another thing I want to show to you, the drainage of the submandibular lymph nodes is going to include the center of the forehead, the upper lip and the underlying gums and teeth, the outer parts of the lower lip and the underlying gums and teeth, with the exception of the incisors. The anterior part of the cheek is also draining over there. The lateral surfaces of the anterior 2/3 of the tongue also drains over there. And the nose with the frontal, the maxillary, and the ethmoidal ear sinuses, I will repeat, center of the forehead, touch it, so ease of retention. Nose with the frontal, the maxillary, nose is also in the center of the forehead, nose with the frontal, the maxillary, and the ethmoidal ear sinuses. Upper lip, underlying gums and teeth. Outer part of the lower lip with underlying gums and teeth, with the exception of the incisors and the anterior part of the cheek. The lateral surfaces of the tongue of the anterior 2/3 part, also efferents are being received from the submental nodes. Now the efferents from the submandibular nodes, they pass mostly to the jugulo-omohyoid node and partly to the jugulo-digastric nodes. These are, again, as you would imagine, deep lymph nodes. And the jugulo-digastric node is the second name for the upper lateral group, right? And the jugulo-omohyoid is the name of the lower lateral group. So they're passing both to the upper lateral group and to the lower lateral group, and these nodes are situated along the internal jugular vein and are members of the deep cervical chain. As you can see, the term deep cervical chain is a very compatible term for what this really is. So into the upper lateral and into the lower lateral. Let's see over here if this makes sense. You can indeed see that the efferents from this region are going over here into the upper lateral group, which is the jugulo-digastric, and also to the jugulo-omohyoid. into the jugulo-digastric and into the jugulo-omohyoid. Let's see if we have anything interesting. Let me see. This is level 1 or submental and the submandibular nodes, and which area is being drained. The lip, my apologies, the lip, the oral cavity and the skin of the lower face. This is basically what is being drained. Then we have the upper jugular nodes. Let's talk about those. Also known as the jugulo-digastric. Why? Because as you can see, this is the digastric muscle attaching onto the height bone. Is a member of this group. It lies below the posterior belly of the digastric. You can clearly see this is the posterior belly of the digastric and this is the location, right? And between the angle of the mandible and the anterior border of the sternocleidomastoid. This is the sternocleidomastoid. So between the anterior belly of the anterior border of the sternocleidomastoid and the angle of the mandible, which is over here. So we have the location over here of the jugulo-digastric lymph nodes, right? In the triangle bounded by the posterior belly of the digastric, it lies below the posterior belly of the digastric between the angle of the mandible and the anterior border of the sternocleidomastoid. In the triangle bounded by the posterior belly of the digastric, which I've already identified, the facial vein and the internal jugular vein, right? So the internal jugular vein is somewhere over here. You can see the posterior belly of the digastric, and right, so you can already see the posterior belly of the digastric. In this area we have the internal jugular vein, and the facial vein kind of crosses posterior belly of the digastric. So this is then the triangle in which we can see the jugulo-digastric lymph nodes. Facial vein, internal jugular vein and the posterior belly of the digastric, and this is given in the image in BD if you have it. So figure 8.29, and you can see the triangle. And it is the main node draining the tonsil, and this is an important thing to understand, that the jugulo-digastric lymph node is the main node that is draining the tonsil. It is even written over here. It is draining the tonsil and also the parotid area. As you can see, this is near the parotid area, so that does make sense. But most importantly, this jugulo-digastric is the main lymph node draining the tonsil. Now let's talk about the middle jugular node, and these drain the thyroid and the parathyroid. You can see the thyroid. So the thyroid and the parathyroid glands are draining into the middle jugular lateral lymph nodes, and they receive efferents from the pre-laryngeal, the pre-tracheal and the para-tracheal lymph nodes. All of these are in the deepest lymph nodes, as I've already shown you. From the pre-tracheal, the pre-laryngeal and the para-tracheal lymph nodes, these efferents are being received by the middle lateral group, which I just showed you. So they're receiving from the deepest lymph nodes because this is primarily draining the tonsil, right? But also the oropharynx. What about the lower lateral group, known as the jugulo-omohyoid, because this over here is the omohyoid muscle, this is the inferior belly, and this is the superior belly, and so this is the jugulo-omohyoid muscle because it is now related to the omohyoid. As you can see, the omohyoid and the digastric, they divide the anterior triangle into 4 smaller triangles, and the lies just above the intermediate tendon of the omohyoid. This is the intermediate tendon of the omohyoid, should be just above it, under cover of the posterior border of the sternocleidomastoid. This is the intermediate tendon location, this is the posterior border, right? So just under cover of it, because this is a deep node, and just above the intermediate tendon, this is the area. Right? And the efferents of the deep cervical nodes. We're talking about the ones we have already mentioned. They join together to form the jugular lymph trunks, one on each side. The left jugular trunk opens into the thoracic duct because the thoracic duct is on the left side. Right trunk may either open into the right lymphatic duct or directly into the angle of the junction between the internal jugular and the subclavian on the right side. This is important to note Again over here, you can see parallel to internal jugular vein written over here. You can see the jugulo-facial venous junction, because it's a junction between the facial vein and the internal jugular vein where it is draining. And over here it is written along the accessory nerve, and you can see this is the jugulo-subclavian venous junction. So the jugular trunk is going to be formed over here and is going to drain into the thoracic duct. You can see this is the outline of the internal jugular vein over here. And this is the where we have the junction. Right. So this is the fourth area, right? And you can see the drainage areas quite clearly. Again, you can see the pre-auricular lymph node, you can see the post-auricular, you can see the buccal, you can see the submandibular, you can see the submental. This is the upper cervical, this is the middle cervical, this is the lower cervical. You can see the pre-tracheal drain into the middle cervical, right? You can see the nodes of the posterior triangle, and you can see the supraclavicular, and you can see that those of the posterior triangle, they drain into the supraclavicular, and they're not the only ones. Submental, submandibular, right? This is submental, this is submandibular. Level 2 is this one, this is the upper jugular, this is the middle jugular, this one is the lower jugular, and then we have these over here. This is the lower, this is the posterior triangle, or the lymph nodes of the posterior triangle. Again, you can see the submandibular, and you can see the submental. See if I can find another interesting image. This is the lymphatic drainage of the pre-auricular, the mastoid, the occipital. You can see the submandibular, the submental. You can also see the anterior superficial, and you can see the lateral superficial cervical. So to repeat, we have the upper, we have the middle, and we have the deep. So the upper is known as the jugulo-digastric because it is in the triangle between the internal jugular vein, the facial vein, and the digastric muscle. It is beneath the digastric between the angle of the mandible and the anterior border of the sternocleidomastoid. Now the drainage area is just something you have to kind of find a way to understand, that it is primarily going to be draining the tonsils. That is what you need to remember if you remember nothing else. Over here you can see that what is written is that the laryngotracheal thyroidal region is going to be draining into these lateral groups, and you need to know that the upper lateral group is going to be mainly draining the tonsil. The second is going to be receiving the efferents from the pre-tracheal and the pre-laryngeal lymph nodes. Additionally, it will be draining also the thyroid and the parathyroid glands. The lower lateral, on the other hand, is going to be the main lymph node of the tongue. This is the important thing. Look over here to inferior deep cervical lymph nodes. So, and the lower lateral cervical lymph nodes are indeed the same as the inferior deep cervical nodes, and they are also given the name the jugulo-omohyoid node, and it is above the intermediate tendon of the omohyoid under cover of the posterior border of the sternocleidomastoid, and it is the main lymph node of the tongue. This is a very important thing to understand, that the lower cervical lymph nodes, the lower lateral cervical lymph nodes, are the main lymph nodes of the tongue. So you need to remember all of this rather well. Now let's talk about the lymph nodes in the posterior triangle, and you can see efferents of the deep cervical nodes, they join together. I'll go over this again, that they're present around the spinal root of the accessory nerve. Now the efferents of the deep cervical nodes, so we're talking about all of the ones we have considered. the submental, the submandibular, the middle lateral, the upper lateral, the lower lateral, and those in the posterior triangle, they all form the jugular lymph trunks, which drain either into the thoracic duct or directly into the jugular-venous triangle. Let's talk about the deepest groups, and then we'll talk about the main lymphatic trunk. Now the pre-laryngeal and the pre-tracheal nodes, they lie deep to the investing layer of the deep cervical fascia, which kind of like is a sheath for the neck. Now the pre-laryngeal nodes on the cricothyroid membrane, right? So this is the thyroid gland. Over here we have the cricoid cartilage. So they're on the cricothyroid membrane and the pre-tracheal in front of the trachea below the isthmus of the thyroid gland. This is the thyroid gland isthmus. These are the lobes. So below the isthmus we have the pre-tracheal nodes. They drain the larynx, the trachea, and the isthmus of the thyroid, draining the trachea, the larynx, and the isthmus. They also receive efferents from the anterior cervical nodes. So we're talking about the anterior superficial cervical nodes also draining into the pre-laryngeal and the pre-tracheal nodes, right? And the efferents, they pass to the nearby deep cervical nodes. As we've said that they basically pass into the middle lateral group of, that is around the internal jugular vein. So these are lying deep to the investing layer of the deep cervical fascia. We're talking about the pre-laryngeal and the pre-tracheal. This is on the cricothyroid membrane. Over here it is shown on the thyroid, and this is just below the isthmus. They drain the larynx, the trachea, and the isthmus, and they drain into the, also they receive efferents from the anterior cervical superficial nodes, and they drain into the nearby deep nodes. Now let's talk about the para-tracheal shown over here. They lie on the sides of the trachea and esophagus, so not just the trachea but also the esophagus. This is the esophagus, and they receive lymph from the esophagus because they are on sides of it, the trachea on sides of it, the larynx also, and pass it on to the deep cervical nodes. So the deepest groups are also draining into the deep cervical nodes, because the deep cervical nodes, from there we have the formation of the jugular trunk. Let's talk about the retropharyngeal nodes. Now the retropharyngeal nodes, they lie in front of the prevertebral fascia. This is the prevertebral fascia around the prevertebral muscles, and behind the buccopharyngeal fascia, which covers the posterior wall of the pharynx. This is the posterior wall of the pharynx, and this in green is the buccopharyngeal fascia that encloses it. So in between these two fascia, the prevertebral and the buccopharyngeal, we have the retropharyngeal lymph nodes. They extend laterally in front of the lateral mass of the atlas and along the lateral borders of the longus capitis. So they're extending like this. This is longus capitis, a prevertebral muscle. What are they draining? Retropharyngeal, they drain the pharynx, the auditory tube, the soft palate, the posterior parts of the hard palate, and the nose. Their efferents, interestingly, they pass to the upper lateral group of deep cervical nodes. Retropharyngeal nodes drain into the upper lateral group of deep cervical nodes. So this is an interesting thing to keep in mind, because they have specified the nodes to which they're going to be draining, right? The retropharyngeal nodes lie in front of the prevertebral fascia behind the buccopharyngeal. This is posterior, this is anterior. So prevertebral fascia and the buccopharyngeal over here, they drain they drain the pharynx, they drain the soft palate, they also drain the posterior part of the hard palate, right? And they also drain the nose. Interestingly, they also drain the nose. So we'll talk about some MCQs, and then we'll talk about the lymph trunks. Now let's start considering the various MCQs that can come up. For example, you have to tell which one is correct. Regarding the lymphatic drainage of the head and neck, number 1, does the right jugular trunk drain into the thoracic duct? Is this true or false? It is false, because we have two trunks, the right and the left. The left is the one that drains into the thoracic duct. The right either drains into the right lymphatic trunk or directly into the jugulo-subclavian venous junction. Second point, is it correct or false? The deep cervical group of lymph nodes, they lie in relation to the external jugular vein. This is false, because they lie in relation to the internal jugular vein. Which nodes lie in relation to the external jugular vein? The lateral superficial cervical nodes. The tip of the tongue drains into the submental lymph node. This is correct. The jugulo-omohyoid node of the deep group drains the lymph from the palatine tonsil. This is false. The jugulo-digastric drains the lymph from the palatine tonsil. What does the jugulo-omohyoid do? The jugulo-omohyoid is the main node for the drainage of the tongue. The jugulo-digastric node drains the lymph from the tongue. It does not. What it does is that it drains the tonsils primarily. Next MCQ. The submental lymph nodes drain lymph from all of the following areas except number 1, the tip of the tongue. They do that. Number 2, the median part of the lower lip. That is possible. The median part of the upper lip, definitely not, because the upper lip is drained by the submandibular. The chin, yes, it does drain it. Median part of the floor of the mouth. So we know that the median part of the lower lip can be the answer, because the outer parts are drained by the submandibular and the median is not drained by the submandibular. Some other stuff. The carotid triangle hosts the following group of lymph nodes: parotid, mastoid, laryngeal, deep cervical, or submandibular. If you're confused, try to remember what you do know is present in the carotid triangle. What is present? Internal jugular vein, and so you can understand that the deep cervical lymph nodes will be the ones hosted in this area. Superficial cervical lymph nodes are located alongside which veins? The anterior and the lateral. This is something that can come up in an MCQ. And that submental lymph nodes drain the lymph from number 1, upper lip, no. Number 2, parotid gland, no. Upper incisors, yes, maybe. 5, tip of the tongue, definitely. So you'll go with the one that you're definitely sure of. So that was the important MCQs. Some other ones which we'll be considering.